All right. Yeah, we'll chat after this. Yeah. It is 1 o'clock. All right. Good afternoon, everybody. Welcome to our workshop. I'll go ahead and call today's meeting to order. This is the Flagler County Board of County Commissioners Workshop. It's Monday, October 20th, 2025. It is 1 o'clock p.m. If I could have everybody stand for the pledge, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. At this time, we take a moment of silence for individual prayer, reflection, or meditation. As part of this moment, I'd like to take a special pause to remember Jorge Salinas, who faithfully served the county and community with dedication, professionalism, and kindness. We laid Jorge and his wife, Nancy, to rest on Friday at the Jacksonville National Cemetery. Jorge's leadership and friendship left a lasting impact on many of us here, and his legacy continues through the people and programs he helped shape. We also take this time to honor and remember our first responders and the men and women in our military who keep us safe and protect our freedoms at home and abroad. All right, thank you. I'm going to ask the board if it's okay, anybody objects to inserting a public comment at this point in the agenda. There was a request due to time constraints that we allow public comment, so I didn't know if anybody objected. Go for it. Okay, so I'll need a motion to add public comment to between item 3 and 4.
Second.
I have a motion by Commissioner Richardson, seconded by Commissioner Hanson. All those in favor signify with aye.
Aye.
Aye. All right, thank you. This time I'll open it up for public comment, if anybody wishes to address the commission. Now's your time.
My name is Howard Holly, CEO and publisher of Touchpoint Innovative Solutions. We publish Evolve Magazine, Estabana Magazine, Evolve News, and Parent Magazine. I want to first thank you for your service and your time and your talents. They're very much appreciated, though you might not hear it as often as you should. Over the August and September time period, I interviewed city council members, county commissioners, and city and county administrators. I found some common themes and some shared views that I wanted to communicate. Number one, there is a shared view that there is a correlation between economic vitality and quality of life that we all seek. Number two, that there is an over-reliance on residential property taxes, which is not sustainable. Number three, that we must significantly and immediately increase commercial and industrial property investments in our cities, our towns, and the county. And lastly, number four, we must improve the job base. More jobs, better paying jobs, career jobs. Now, as you know, here in Flagler County, Palm Coast represents 78% of the county population. What you may not know is that in Leon County, Tallahassee represents 69%. Very similar. I had an opportunity to spend every month over a 10-month period in Tallahassee when I was appointed by former Speaker Paul Renner as a member of the Florida Museum of Black History Task Force. What I learned is that they have a model that we should consider replicating and emulating. Leon and Tallahassee created a collaborative, integrative, and strategic Office of Economic Vitality. I believe it could and should be modeled and considered by us. Now, who's us? Government, you, businesses, and residents. The first step in that process is to form a Blue Ribbon Commission to learn what we can from Leon and Tallahassee. I'm not suggesting we make a decision here, but let's model them and learn what they did and how we might execute that. So one of the things we have to do is, the time is now. Martin Luther King said, "We are now faced with the fact that tomorrow is today." We are confronted by the fierce urgency of now. In the unfolding conundrum of life and history, there is such a thing as being too late. This is no time for apathy or complacency. This is a time for vigorous and positive action. Thank you. God bless you.
Thank you. Appreciate that. And I think we did chat that we've got some workshops coming up to delve into our economic development. So I think the timing is appropriate.
Yeah, the timing is now.
The timing is now.
Thanks a lot. Appreciate it.
Thank you.
Thank you very much. Safe travels.
Thank you.
All right. Again, want to welcome everybody to our workshop. We have everybody here today in attendance, so thank you to all the commissioners. We're going to start off with a presentation from Health and Human Services on the adult daycare and community service grants. So,
Mr. Chairman?
yes, sir.
Did you want to make that the opening remarks from the audience and just continue to see if anybody else wanted to have anything? Are you going to?
I didn't officially close public comment, did I?
No,
Okay.
but, I mean, we could leave it open and have that, and then we just go past it on the.
Well, we'll open it up at each. We won't keep it open. but-
Okay.
So is there anybody else that has public comments or wishes to speak on public comment? All right, seeing none, we'll close it. But thank you for
Okay,
picking that
sure.
up for me. And we'll go ahead and go to Health and Human Services presentation.
So as they're walking up, I just wanted to say this is a follow-up to the recent budget discussion that we had. Today's presentation and discussion that they're going to provide is an opportunity to take a closer look at a couple areas that came up when we were talking about the budget. One was the adult daycare. The other one was the community service grants that they provide. We know that the board has approved the funding for the current fiscal year, but there was some questions raised about long-term sustainability and direction. And then as it pertains to those service grants, there was some questions about the process that we use to allocate and manage those funds. So hope today's discussion will allow us to review the practices and consider any adjustments that might be appropriate, just to ensure continued alignment with the board's policies and community needs. So with that, I turn it over to Joe and Dawn.
Thank you. Welcome.
Thank you. Good afternoon, Commissioners. My name is Joe Hegedus. I'm the Director of Flagler County Health and Human Services. With me is Dawn Lord, our Program Manager for the Adult Daycare Program, as well as Kim Bennett, who is our Human Services Program Manager. And we'll bring both of them up over the course of our presentation. But as Ms. Petito mentioned, we are here today to discuss the Adult Daycare Program and our community service grants, both of which are under the Health and Human Services umbrella. To just start with a bit of a background and overview about the adult daycare. Start off with some pictures. Here's the exterior photos, some photos from the inside. We do a lot of different activities in the program, and we'll touch base on those, but we just wanted to give you kind of a visual reference for our facility. Our staff, we're comprised of 4.5 full-time staff. Dawn Lord, as I mentioned, is our registered nurse program manager. Sue Collister is our licensed practical nurse. Julie Anderson and Linda Williams are certified nursing assistants. And Teresa Toller is a part-time on-call CNA or certified nursing assistant. So again, we have 4.5 staff for this program. As you can see, these are medical staff. These are medically licensed, certified, and trained staff. Licensed professionals that provide a family-like atmosphere and environment to patients in our program. Between them, staff have 137 years of combined experience, and our longest employee has been with us for 19 years. State regulations mandate nursing, staffing, and medical staffing in all state-licensed adult daycares. A little bit more about the history of the adult daycare. It came under county's operations in the early 2000s. Prior to that, it had been part of the operations of the Flagler Council on Aging, as I understand it. At one time, we were co-located with the Congregate Meal Senior Center. That later moved on to different locations. The adult daycare is named after David Siegel, who, doing some background research, learned was a tireless advocate for seniors and sought to improve the lives of seniors in our community by providing meals, transportation, spiritual guidance, and simply keeping folks from isolation. And in addition to that background, I did want to mention that we are the only state and Medicaid licensed adult daycare in the county. The state licensing is through the Healthcare for Administration, and of course Medicaid administers their licensing. Adult daycares have existed for roughly 30 years across the country. They cater to and are critical to individuals needing help and those who are isolated. Nationally, adult daycares provide respite for 50 million caregivers and their loved ones. They provide a secure intermediate level of care before entering a highest level of care, whether that's a skilled nursing, long-term care, or similar facility. Just wanted to briefly touch on community need and the occurrence of some of the health conditions that bring folks to our door. The majority of the folks we see are suffering from Alzheimer's or dementia or related cognitive disorders. And in 2024, Flagler County saw roughly 4,500 cases of those for adults aged 65 and older. And the death rate in our county was 23, close to 24 for every 100,000. Both of those are higher than the state rates. Similarly, for the hospitalization rate, we saw 307 adults with dementia hospitalized in 2024 for every 100,000. Flagler seniors, as you likely know, comprise a larger portion of our population than they do in other communities. Roughly 32% of Flagler's population is seniors. That's roughly double the national average and about 10% higher than Florida. Nationally, we saw about 34 Alzheimer-related deaths per 100,000. And again, this is a high rate of occurrence throughout the community. It's the 6th leading cause of death in all ages and remained a leading cause for those 65 and older. And that's just Alzheimer's. That doesn't include dementia. That doesn't include the many other cognitive variations and disorders that might be involved there. So Florida has, unfortunately, a higher number rate than across the country, and that's only projected to increase by 2060, as studies have shown. In addition to these rates and factors, I did want to share that studies have shown that hospitalization of folks with these diseases and ailments only exacerbates and progresses those diseases further. The goal with a lot of these ailments is to try and slow down the progression and bring in treatments that slow that progression down, right? So social activity, engagements, singing, dancing, all these different bits and pieces help them kind of keep their skills and abilities and maintain that as much as they can before folks progress to needing a higher level of care. So when do families consider an adult daycare? Often their loved one is unable to organize or manage their everyday activities. They, again, would benefit from socialization. They're cognitively or physically challenged, but don't require 24/7 care. They're in early stages of dementia or Alzheimer's, and it's typically unsafe for them to be alone. And often their caregiver may be working outside of the home or have other needs and obligations, and this type of program provides them an opportunity there. Just briefly, some of the benefits of the adult daycare. Our program provides a sheltered, secure, and medically supervised surrounding. We provide medication administration, We bring in outside agencies to support speech and physical therapy, assistance with activities of daily living, that's toileting, dressing, bathing, those kinds of things. We provide nutritional meals and feeding assistance, and again, a break for caregivers. But I just want to jump back to my main bullet there, I think is the most exciting part of what we do. And the fun part is the activities of arts and crafts. We have therapeutic dog visits, sing-alongs, bingo, sitter size, and we'll show you some of these activities in just a moment. But again, all of these help stave off the progression of these diseases over time. So here's a photo from our pet therapy visit, one of the best days at the center. Here's a photo of some of our patients doing a kind of a cognitive challenge or game, a puzzle, similar to dominoes, but takes it up a notch. And again, this kind of speaks to the socialization, integration, the activities that this program brings and provides to our participants. Here's a little video of a sitter size activity. So this is another example of our just keeping folks moving and active, along with those other activities we mentioned. So that provides kind of an overview of our program. I wanted to jump now into program data. As you can see from these figures here, we average roughly 20, 21, 22 enrolled clients in a month. We've averaged about 20 to 25 new clients every year, but the unfortunate nature of the program is that there's turnover, right? So folks, their disease does progress. They do have to seek higher levels of care. So as you can see, we end up discharging typically roughly as many folks as we bring in each year. There's a bit of a turnover there. We provide, again, a lot of meals, roughly 2,300 meals a year. We bill for all of the hours that we provide. So all of the clients that visit us receive a bill, whether it's them directly or Medicaid or some other variation. And it also talks, there's some other figures here that speak to our outreach and inquiries for service. We provide trials so folks can come in and visit for a day to see how things go and see if this works for them. And then these last two bullet points or data figures touch on the average clients per day, roughly 9 to 9.5, and then they stay for roughly 5.5 hours per client or per patient. I did start going back to early 2000s to look at data, but that was when COVID was hitting us, and it didn't seem appropriate to compare those figures. Excuse me. They were obviously much lower in that time. These are some general kind of costs and things to factor in operating daycare. The costs per client can range, and depending on the type of service and the level of service provided. So some communities, it's really just a place for folks to be. There isn't the medical level of care. They're not licensed. They're not, meeting some of these higher standards. So they're on the lower end of cost. Whereas the higher medically oriented ones are, upwards of $70 to $100 a day in terms of per person costs. Some provide transportation, others don't, meals, activities. But again, if we are licensed by the state, which we are, we must have full-time nursing services available. Some of our sources of revenue or income for the program, we do contract with 4 Medicaid HMOs that are currently approved to provide services in our region. Their rates, reimbursement rates vary, but it's roughly $60 a day that we'll get back for serving one of their patients. Our private pay rate is currently set at $10 an hour. We last raised that in 2023 from $8 an hour. And the breakout between private pay and Medicaid clients varies. In the past, we used to be a little bit more heavy on Medicaid. We've swung the other direction. Now we're a little bit more heavy on private pay, with roughly 2/3 of clients being private pay. And again, private insurance, typically people will pay out of pocket and then get reimbursed. Sorry, let's just make sure I got all my notes here. Oh, one other thing I wanted to mention. So compared to surrounding areas, St. Johns County, their private pay rate is $15 an hour. Volusia County, it's a little bit of an apples to oranges. Their adult daycare is not the medical licensed model. So theirs is $11 an hour, but again, it's not the same type of service and structure. So yeah, I did want to mention that in terms of our surrounding areas. Other sources of funding. So obviously a good portion of funding comes from the county general revenues. These are other opportunities for us. Unfortunately, the only one that seems the most viable currently is the ADI, the Alzheimer's Disease Initiative. That is currently available for us and I don't want to say underutilized. We can shift some of that funding over without impacting other services drastically or reducing services drastically. These other grants, the OAA and CCE grants, those would mean if we pulled funding from those, it would mean a reduction in services in other areas, whether that's in-home support, Meals on Wheels, or some of those other services we provide. So really, it's the ADI is the one that we're honing in on and focusing on as an opportunity for us. There is also funding through the Veterans Administration. I understand we'd pursued that in the past prior to my time here. Didn't pan out, but we're obviously able to and looking at maybe trying again and seeing if there's an opportunity there as well. Yes, okay, so diving deeper into budget and program costs, I've got kind of 3 fiscal years of numbers here for you to reference. The first is the fiscal year 23-24. Our adopted budget was around $350,000. And then our actual costs in fiscal year 23-24 were about $300,000. In 2024-25, our budget was $409,000, and our actuals were about $323,000. Now, you'll notice there was a bit of a jump there in terms of costs. I think that's mainly associated with the increase in the required hourly compensation rate under Medicaid. There was changes to increase the compensation rate, so our administrative costs went up there. But you can see in fiscal year 24-25, we we're still kind of closing the numbers out, but we were on track to receive about $100,000 back in co-payments, Medicaid reimbursements, and the like. So the final program cost, if you want to look at it that way, was roughly about $224,000 for year 24-25. And then again, similar types of napkin math there, if you want to call it that, for this fiscal year. So if some additional numbers, if that's not enough for you, excuse me. This roughly breaks down, if our current average attendance of 9 to 10 folks a day, that breaks down to about $98 per client per day. That's our cost of operation per client per day. So this brings me to the question of the future of the adult daycare. I think, as Heidi referenced, there's been some conversation at the board about where do we go into the future. As you've stated, the program is currently funded through fiscal year 25-26. As staff and as program administrators, we've got a few ideas that I've touched on already and that are listed here on ways that we could further shore up the finances and attendance and all these other aspects. The alternative that I think the board is considering is, do we look towards closure? And if so, what would that look like? Timelines, course of action, and the like. Obviously, as the program administrator, my hope and goal is that we can continue to try to operate the program and bring to bear some of these additional opportunities to shore up that financing. So again, increasing the private pay rate, revisit the minimum hours that folks attend. Currently, that's at 4 hours per week. Maximizing our grants, maybe looking for efficiency and space or other ideas that can continue to shore up our program operations. So with that, I think that's the bulk of my points, my slides. But again, I think, we're here again today to determine, is this something of interest to have us pursue forward as staff, or is the board interested in us looking at the alternative of closure and what that might entail in terms of timelines and the like? I guess I'll pause here. Dawn, is there any additional points you wanted to make or comments? Okay.
Welcome to,
You'll have to come over.
sorry.
That's all right.
Happy to answer any questions that you may have about our day-to-day operations or what we do or our clients or anything that might help you understand this program a little bit better.
And just for the record, state your name for the record.
Oh, I'm so sorry. Dawn Lord, I'm the Adult Daycare Program Manager.
For those who are listening
Thank
or
you.
watching. Yes.
So with that, I believe we welcome questions, conversation, feedback, input from the board on where would you like us to put our efforts?
So
Oh, go ahead. Sorry.
go ahead. We'll start at the end, Mr.
Is the 4-hour minimum, is that a problem? I mean, do people want to be less than 4? Or why 4 hours? What's the?
Quite honestly, it was 4 hours when I got there. We do have people who come to us because they just need a little bit of a break. I just need to go to the gym twice a week. I just need to whatever. So the 4 hours is what they're looking for, not necessarily a longer day. It really is, it really depends on what their needs are.
And if you raise the minimum to 5 hours, does that mean if they bring them for a shorter amount of time, they pay for the 5 hours?
No, so we bill, currently we're billing hourly in 15-minute increments. So if
So they
you,
just can't come if you're not going to come for 5 hours.
if they're not going to come for 5 hours a week, we would need to convince them to come for 5 hours a week, or they would not be eligible for the program.
Okay, thanks.
All right, Commissioner Pennington.
So 2/3 of the program is self-pay, private pay, at $10 an hour right now. And then the rest is Medicaid and private insurance.
Yes.
Okay, so 2/3. So 2/3 of how many? 21 a month is private pay. And is that just because they're not on Medicaid or?
So yes, sometimes they're waiting for elder source to make them eligible for other programs like ADI or long-term long-term care management. Sorry, this isn't usually my thing. So they private pay until their situation changes and they come off the wait list, and then they're eligible for other programs.
Is there not a facility that they could go to that's one of these adult daycares in town that charge per day or that offer this service or?
So currently, we are the only adult daycare in town. There are two volunteer programs at churches, one at St. Mark's and one at PC3. that do a few hours. I don't know much about the PC3 program. The St. Mark's program does 4 hours a day on a Thursday. And it's all volunteer, and they do not, they have to be able to feed themselves and toilet themselves in order to participate in that program.
There's an adult daycare on Old Kings, which I see all the time. Do you know what that is, the Palm Coast Adult
That
Daycare?
has closed. That closed about a year and a half ago, and they were not licensed.
So we're the only game in town.
Yes, sir, we're the only game in town.
How does it compare to having somebody like Granny Nannies come to your house?
So when Granny Nannies comes to your house, your loved one is not getting the socialization that they would get when they come with us, and there's, you know,
Right.
8 or 9 other people there. Also, a lot of people have told me that they're uncomfortable leaving the Granny Nanny representative in their home
While they leave.
while they go out to do their grocery shopping or getting their hair done or whatever it is they need to do. So that doesn't really give them the break that they're looking for either.
Well, I hate to dispute that. My mother is 92 with dementia, and Granny Nannies is with her right now. And we love her, and she plays games with them. And whatever level of care I want for her, they give it to her. So bathing, it gives me actually a little bit more hope and a little bit less anxiety having somebody in her home, because with dementia, as it progresses, she doesn't really know where she is. So I feel my parent and my loved one is receiving the right level of care. So the general comment about people not, I think it just depends on the individual caregiver, meaning me, and the person being cared for. So I know my situation. So I just went from the doctor's office after hospitalization and called Granny Nannies and had an extra 5 hours added on in 3 seconds. So there is flexibility there. And if my mom wants to play games, she plays games. If she wants to play cards, she plays cards. But that's the level that she's at. So maybe for other patients, they're all at different levels. So to make a general comment that people tend not to feel like they're in the best of care, this lady texts me every breath my mother takes. So I'm good with it. So Granny Nannies, visiting angels, they cannot administer medications like you all, but that's okay because I do it and I want to do it. So that's where their limitation mostly is. They can take her in their car. If I approve it, they can go to the movies. There's a lot of things that can happen. Overstimulation from my mom does not work. And when you get her in the hospital environment, she just falls apart. So we're trying to keep her out of the hospital because that's what you need to do with dementia.
Yeah.
But again, I just wanted to give you my personal experience, not so much about our program, but that's my personal experience, and I'm blessed to be able to do it. So I'm glad I can do it. But
I appreciate
Granny
that.
Nannies, or let's just not put the name on it, Granny Nannies, let's just say in-home care. In-home care for us is working very well.
I did not mean to generalize in regards to everybody. I was just telling you the feedback that I have received. Granny Nannies is great if it works for you. It doesn't, like you were saying, not everything is a one-size-fits-all.
Right.
I think we're given an option here, which is really good. That's all, it's just an option for the public. Yeah. I agree with Kim. My dad we did it in home until he just died in home. You know, he was transferred to hospice, but still in the home. And that worked for us. That was fine. That worked fine. So
This is a very sensitive subject for everybody.
Absolutely.
As a teenager, I was a candy striper in a nursing home. And I've spent my teenage years living with my 96-year-old great-grandmother, 92 to 96, sharing a bedroom with her. She didn't have dementia. We were blessed to not have that. I've got customers over the last 40 years that I've watched slowly turn away and turn into another person. We'll just say they morph into somebody unique and different, including my mother-in-law. So I've spent 12 years with her, watching her ail. Our family stepped up and took care of our relatives. These are people's relatives, and I understand there's a time sensitive. We have friends that'll come and sit and spend some time. If I have to get my hair done, when one of your clients said, I have to get my hair done, you can take somebody with you, unless they're walkers. And you know, how many times do we get silver alerts? It's every day. This is a very tough situation for all of us. It just is. I want to make the best for our budget and make something that's fair and acceptable for everybody. And it's limited in comparison to other services. That's where my thoughts go. You do 1,700 plus of Meals for Wheels. Tell me what's the operation and how you handle that? Because I did that in Miami.
So just an
You said-
overview of Meals on Wheels in general?
How do you how do you interact with Meals on Wheels?
So this program doesn't necessarily interact with it directly, but it is under our senior services umbrella. And Meals on Wheels is every Tuesday, participants will receive 5 frozen meals that are delivered by volunteers and staff. And it's every week that cycle.
So it's just a transportation hub.
To
More
a
or
degree.
less.
I mean, we coordinate the meals, we make sure
Right.
they're nutritional, they meet all the dietary restrictions and guidelines, that, you know, they're delivered, we provide nutritional education, you know, and there's kind of the unwritten component of again, socialization, in contact, eyes on, you know, the participants so we can see how their living conditions are, those kinds of things.
So the volunteers, from a volunteer organization, I'm assuming?
No,
Or
we
volunteers?
recruit them directly and
Okay,
coordinate
so
that.
they have a checklist on looking at the people that they're delivering the food to? How do they evaluate them? I'm
Well, it's not a formal evaluation. It's more of just kind of a organic, you know, this person's having a hard time with X, Y, and Z, or we see that their mail's piling up or something, you know, so it's kind of a more frequent set of eyes on the participant, the client, and just to get support for them if they need it. They're not doing it, the volunteers aren't doing like formal assessments or treatment or services or anything.
right, so you're checking to make sure they're getting nutritionally fed
Yes,
5 days a week.
yeah.
So those other 2 days, what happens then?
Unfortunately, our budget is not to the amount
So
where
we're
we can
paying for
provide.
those meals?
We pay for the 5 meals per client, yes. Well, they're come from the grant. They're funded by a grant.
So the
yes.
grant is covering that cost?
The majority of it, yes. There's a match and you know, partial component under
Things
the
have
county.
changed since I'm a teenager, that's why I'm asking these questions.
Sure. So yes, yeah, the bulk of it's funded by an Older Americans Act grant that we have, yeah.
The other thing I was looking as you were speaking, and I appreciate your presentation because it gives us a lot more detail than just walking through the building, watching people either eat by themselves or being assisted by staff. What was my thought? It went out the door. You said 98 days.
$98
Dollars a day.
Yes.
Yeah, a day. I'm sorry, I didn't put a day. And you had 9,
We average 9 attendees per day, yes.
10, 9,
9 and a half,
per
9
day.
to 10.
Okay. But I just took that numbers and played around with them, and it seems like to feed those 9 people or to care for those 9 people over the year, it was about $12,000 a person. Does that math work? Is that correct or not?
I mean, 9, an average of 5.
Well, and do you get paid $12,000 per person over the year, or from Medicaid or these other options, or are we actually paying for those people's time?
The county does supplement a portion of the cost, yes. And now it's not exorbitant. So for that example,
I took $240,000 and divided it by 9.
sure. I think, yes. So I think, that gets us to where the ballpark, yes, right? So the 94 a day, that was 9 clients or 9 patients at 5 hours a day.
Yeah.
So but out of that, if we're charging them 80, that's the county is supplementing $15 out of the 95, right?
I don't know. I don't have the books in front of me, so I was just doing some quick
So
for your presentation.
out of a $95 cost to operate per client, 15 of that would come out of the county's.
Well, that's $1,000 a month for each consumer,
Yeah, if you calculate it out. I
each
can see that, sure.
each
Yeah.
patient, right?
Yeah,
Okay.
sure.
I just want to make sure my numbers are right. My head is in the right position.
Yep.
Because this is a huge decision. And again, this was brought up during the budget. I think when Commissioner Carney and I we went through the building, and we went into your office first, and then we followed into the facility.
I had already been there.
Oh, you had already been there? Okay. Okay, yeah. So when I went in there, I was a little surprised at the condition of the building.
It is an
And that
older
was a
building.
concern of mine. So
Yeah.
is it cost effective to keep that building for this program? And that's where I think we probably look at, and how many people you're serving, and it's a lot of space for a small dollar.
Sure.
Is it cost effective for us to keep that product? And that's where I guess we came to today. And that's where my mind goes. It's a very, very big challenge for me, both ways, because I am emotionally caring about those folks.
I think the building cost remains, whether that program is there or an alternative. To some degree, I think that it's an older building that will need love and
It needs
care.
attention,
Yeah.
correct.
So to some degree, that exists. But yes, I think that is the dilemma before the board.
I just didn't feel it was enriching in there. You talk about enrichment, and your surroundings are part of the enrichment, especially when it's visual, when people are not in there. They're all past capacity.
Sure. Well, I can guarantee you our staff does the best with what
I know
we've
they
got.
do. They
and,
were wonderful.
make
I saw
the
that.
most out of the
We saw
conditions
that.
for sure,
I
yeah.
saw that.
But
I have
it's-
to say I saw that.
No sugarcoating.
I'm not
It's an
questioning
old
them at
building
all.
For sure,
It's
yeah.
just a little tougher when it's a little dungier to me.
I believe it is on the CIP for improvement, that the building, I believe regardless of where this conversation goes.
Right.
So that could address some of that as well, potentially.
Okay. Thank you for your answers and your honesty, and thank you for what you're doing. I mean, it's not an easy position to be in, and for all those caretakers, I know that your heart is into it 180%, because you want to see your consumers being healthy and safe. Safety's number one there, in my opinion, and I do understand that. So I have compassion, but I have concerns for our costs too, and what we're spending for a handful of people compared to a majority of people. That's just the way it weights out in my mind. But thank you for your presentation.
Thank you.
Thank you, Mr. Chair, for the time to
Absolutely,
be able
thank
to
you.
discuss my concerns.
That's why we're here.
I know, but, I don't want to drag this out in painfully staking.
I've got one question. You mentioned wait list. Can you explain what the wait list is?
So we don't have a wait list for the adult daycare per se.
Or just what was that in reference to?
That was in reference to Elder Source. If you call Elder Source to sign up to get on the Meals on Wheels program or access to one of these ADI or CCE grants, depending upon what you tell them, they rank you and put you on a list.
The patient.
The client, potential client. So from that list, they decide who they're going to pull off in what order for, access to in-home care grants or Meals on Wheels or any long-term managed care. So it's all based on what the caregiver tells ElderSource, and then ElderSource ranks them and puts them on a list.
But if somebody wants to come into the adult daycare, there's no wait list?
No.
Okay, just wanted to make sure that was clear. Okay, I've got some comments. And I'm a proponent of praising in public and coaching in private. Unfortunately, today, there'll be a little coaching. But I do want to thank you and your staff for the work that they're doing. I've received 2 or 3 very passionate, detailed emails from not the clients, but their caregivers about the benefits of them coming to our adult daycare. And one of my mentors and that I worked with extensively at the school district has also talked to me about the importance of having this service and what we are providing to try and influence us on keeping this going. So keeping it going is where my thoughts have been mostly all weekend, trying to figure out where we're at and where we're going. And I think part of my frustration is with the presentation. I really wanted to see you guys come here with a plan, not a, what do you guys want to see us do? I really wanted to see from you guys what your plan and your sustainability model was when you came here today. I didn't want to, if you want us to answer the questions, it's probably not what you're going to want to hear. I would rather understand from you guys how you're going to make this work and how you're going to make it sustainable. So it's just some of the basic numbers, right? You did a good job in showing us that the demand is real and rising in Flagler. But we're here because the model we're under is not sustainable. We're trying to get to a general revenue neutral model or a minimal contribution to move the program, to justify the program. All right, we've got the demand versus the cost. As I understand, each of our employees that work there can see up to 6 people, but you've established a 5-person average. And for Alzheimer's clients, the state sets it at 5.5. But where we're seeing roughly 9 clients a day, that's 38% efficiency. If we want to get to a sustainable model of about 70 to 80% efficiency, we've got to boost that up to 17 to 19 clients a day. And to do that, it's got to be there has to be more work done with the scheduling component. And there's a lot of ideas on how to do that. But I think, what I want to see is the utilization going up. And we have to, that keeps us in compliance with statute. You mentioned the pay rate. So we boosted it to $10 an hour. St. Johns County is at 15. You mentioned Volusia, which is 11, but not licensed and not medical. So just in looking at that, we've got to immediately look at boosting that to probably 12, and then the following year probably to 14. And each $2 an hour increase adds about $30,000 to $35,000 in revenue. And we still have to be compassionate to our clientele and the economics in the area. we've got to set a target for outside funding. So we talked about additional outside funding, but what I want to see is a target. We've got to boost, if what I saw was $20,000, we have to be more aggressive and set a target for additional outside grants or reimbursements. I think the opposite of that is setting a funding cap. Like we're gonna look at the next presentation is on the different organizations that receive funds from us in the community. Without a clear plan, I think the only other option is having the commission set a spending cap like we do with those other organizations, to where $100,000 a year or whatever, and then you guys work within that framework. I don't think that's the right way to go, but I just think, all right, the areas that we've got to work on, where I would like to see a plan, and you've got some time, but I think you owe it to your employees to put this together as quickly as possible and come back to us, because, you know, I don't know that anybody wants to see this go, but none of our budgets are going to get any better in the future. The state's already put out revenue estimates that the second and third year out from this year are going to be really hard financially based on state revenues. And that's what we're looking at having to work with. But so I think the utilization rate has to go way up. We have to adjust our rates. We have to set goals for outside reimbursements and grants. We probably should establish some satisfaction metrics, some surveys, in order to make sure we're doing what we're supposed to be doing to a high standard. And then I think part of that utilization is looking at peak and off-peak hours. I think what could help some clients is if there's peak hours where you're running into trouble scheduling, those could be at a higher rate, or you keep them at the 12, 14 hour, but on the off-peak, maybe we reduce those, so people that are more strapped for cash have the opportunity to schedule on off-peak hours. But I think from my standpoint, I'm just disappointed we don't have a plan from your office that shows how you want to get this ship righted. And my expectation is to say, I don't know what the rest of the board wants, but I would want to see an updated plan on how this is going to, the revenues are going to start matching the expenses and make it sustainable. I mean, I think your employees would demand that you come back to us with a sustainable plan.
I'd be happy to, Chair. Respectfully, though, I feel I've suffered from a lack of clarity of where we were headed, because my understanding is this was a conversation about should we move in that direction, or are we moving for closure? And it seemed efforts of increasing participation and enrollments and that sort of thing were almost inappropriate if we were moving in the direction of a closure. So we hesitated on really putting our eggs into that basket fully before we had a clarity on if that was where the board's inclination was. I'm absolutely happy to put together numbers to this. I have those in my mind, and all those things that you mentioned are exactly what I have pictured as that plan, right? The grants, increasing our hourly rate, revisiting the minimum hours, finding other reductions. In my time here, we've reduced our operating costs by almost $20,000 in just 2 years. Absolutely, first and foremost, in my mind, is stewardship of public dollars and service to the public and my staff. Honoring my staff in that process. frankly, it's been challenging to come up with a plan of action when I'm not sure where the board's inclination is, if we will even be here in 6 months for this. It felt premature to put these things into place if that was going to be the case. I apologize if I misunderstood the direction from the board. That is the dynamic I was operating under.
Right. I'm just thinking of, right, coming to us with just the plan, not that you had to start initiating those things, but if you were coming to us for approval on a plan, then bring it to us and let us look at it, as opposed to giving you where we want you to go, which may not be where you think we need to go.
Well, again, sir, I want to have assurance that if we're creating this plan, that is where we'll be going, right? If we're headed for closure, I just don't want to put our energy there and then build recruitment, build participation of new clients, then a few months later have to close the door and end that service.
but
I think
you
what the
wouldn't do
chairman's
that.
trying to tell you is you need to fight for this. If you want to keep this thing open, well, damn it, fight for it. Come in here and tell us what it's going to take to keep it open. Get us all on the same page and keep it open. I think that's your job, is to table pound and stamp your foot and tell us how you're going to make this thing work. Okay? That's all.
The plan, I don't think the plan is for you to go out and do all that, because whatever should be done or could build it or could reduce the cost, we're assuming that you did all that already. So I remember the budget process saying not to take on new clients until we could reach this point. We, several of us, and I don't know that we had consensus, it was too long ago, but several of us said December. During the process, we funded 2026. So we had time to do this process. But I remember the direction being no new clients in case we have to phase it out. So maybe I'm wrong, but again, I thought I was going to see how we're going to keep it open. So, but I would not start up tomorrow with a bunch of advertising and recruitment and come back and say, look what we did, look what we did. I think your direction is not to do that, but to rather put the numbers on the paper and get a consensus on how, if it's going to work.
I appreciate that. I think one of the dynamics here is that the only grant that can support this is a reimbursement grant, right? So we're making some assumptions. But again, I'm happy to put numbers to it and get it before you all. My understanding of where the questions was the fork in the road, or were we going there or not? And again, happily we'll put numbers behind it. I don't know that that's going to make it a zero balance budget for the county. I don't think that's a realistic goal in terms of the program operations and administration for an adult daycare that's not part of a bigger, medical system of assisted living and some of these other mechanisms. So again, apologies for my misunderstanding, I guess, of what your expectations were today. My thought was that it was here to have a conversation about will the adult daycare continue or not. And it was more of a conceptual conversation. So again,
So just so we're clear, so you have direction. I've heard everybody speak of the importance of the program. Did I miss that? Maybe.
It serves a purpose.
Okay.
There's no doubt. But
Right. So then
At
the
what
but
cost?
comes with,
At what
as
cost?
opposed to, how much through our budgeting process is the commission comfortable on supplementing. And so I would say, and correct me if I'm wrong, that the task is coming back with a options budget, a plan to make this sustainable. And if it's a couple of different options, bring those back to us or work with Ms. Petito on narrowing those down to a viable plan that you can bring back to us if you're looking for us to.
Well, I guess that's my question, is what is sustainable in the board's mind then? Because is that a zero balance of,
I think you bring
offsetting
options
all the
back. You
costs?
bring a zero and you bring one that's not.
I don't believe that is possible. In social service, safety net is not a profit-making industry.
And understood that.
That's bare bones. So
I mean, we're going to talk next about
subsidizing costs,
subsidizing
safety net,
important nonprofits that are doing good things out there, and you fall within that same group. If it was, if it wasn't our own staff doing it, we'd be tasked with probably supplementing it through that process we're going to look at next. So
are there any specifics on the types of figures you would like to see? I mean, you'd like to just see a projected operating budget and cost of pie in the sky, or a couple different scenarios, or
I think it's a staggered plan. I think you phase it because nothing's going to be immediate. You have a plan for the next budget cycle, right? So we're going to work this. You've got this funding cycle budgeted, so we have to budget next year's budget. So come to us with a plan for next year's budget.
Okay.
And then what I probably would see is the following year, what does that budget look like if you continue to bring in clients or bring in outside funds? And what does the second year look like?
Absolutely. Happy to do that, sure.
But I would say the immediate task is the decision the board will make on next year's budget. And Ms. Petito will need an amount to put into the overall budget. So that's what I would work on.
And if I could chime in a minute. So those programs near us, St. John's, I'm not saying it's the gold standard by any means. Am I saying that? Because I can't prove it. But I would definitely get with a successful program, or what you consider a successful program, and get some of their data. See what other sustainable programs in other counties are doing. There's some opportunity possibly for I don't want to use the word growth, but for some staff training, or for it, do you have flexibility? So for instance, when you have in real estate, we know what months are down and we know what months are up. I mean, there's data out there, so we know how much more money we have to use in advertising in the month of November that
Slows down.
because it slows down. Right. Do you have flexibility in staffing to flex hours or to change hours or to make people part-time that are currently full-time? How are you going to show efficiencies in delivering that service? And there's models out there, I'm sure. I don't know that ours is one of them, but I'm sure it's going to take some homework. But
again, the sustainable models I'm familiar with, an adult daycare is part of a continuum of resource that organization will bring. So they'll have skilled nursing home, assisted living is kind of a progression point there. And again, it's a bit of a comparing apples to oranges, because those are higher cost programs that might offset some of the initial loss of this kind of feeder program of an adult daycare. But again, happy to look at those and see what those are. Yeah.
Well, I would say a next presentation could be January, because we'll start budget discussions in December with priorities. And so if you can get back to us in January, would probably be a good timeline.
I have one. I just want to correct myself to make sure. I'm not, who put this together, this paperwork? Okay, so this was yours, Joe, right? You
Yes,
put this
ma'am.
together? Okay. So there's a part in here about community services grants.
Yes,
We're
we're
doing
going
that next.
We're going to jump into that momentarily.
Right, I understand that. So your final program cost, you're anticipating for next year from 25, well, that was 25 to 26 from, but this was 239,000, right? 811.
Projection, yes,
Right.
ma'am.
That's the cost from the county. Yet, 1, 2, 3, 4, 5, 6, 7, 8 programs. I'm just going to, this is the way I'm reflecting it. Maybe I'm not thinking about it properly. Are 470,000. So your one program is way out of line with the other programs as far as proportionate to service. Does that make sense? Am I
not
creating
sure.
a, like they're 200, so you're 200, on top of that would be 600, about $700,000 for all of them, with all of them.
Yes, I mean, the grants are in a separate division that's under
Right.
Human Services.
Right.
So it's not part
But
of
I'm
the same.
saying it's 700, right, 700 between all of them.
Yes. I
And
mean,
yours would be almost at least over 1/3 of those other ones, correct?
230 out of 750, yes,
40?
roughly, yeah.
Almost half.
Yes.
So
Well,
that
quarter,
seems,
third.
that seems a little bit off scale to me, serving 9 residents. You know, in that capacity, because some of these people are serving probably 100 people.
Sure.
And I'm
So,
just
I think-
looking at the viability of all of this, and that's all I'm not looking for you to defend it.
No, well, just
I
wanted
want to make
mention
sure
that-
I'm correct with the numbers that I'm looking at.
Yes.
So my
The 9
mindset.
is an average, though, however, so there's,
Of course.
there's higher
There could be
days.
12, there could be 15, there could be, but there could only be just so many,
Up to 20.
20, something like that. Okay.
Yeah.
Okay, I just want to make sure I understand it.
Yes, yes.
Thank you for your information. I appreciate it. That's all I have.
Okay.
Thank you, Chair.
Does anybody, I just want to make sure you have the right direction from us. Does January seem feasible?
I think so.
Okay. And then, is that, just so I have a consensus, is that the direction you would want to see in January is a budget proposal from HHS on funding us for the next year so that it could be, we have some time to talk about it before it becomes integrated into the next
For
year's
the
budget?
We'd be discussing it again in January.
Yeah.
Oops, I'm sorry, I'm not on the mic. So you're requesting that we go ahead and have them do their due diligence of what
Right.
you've asked, and then we would review it in January when we
Right.
start our budget.
Right.
I'm okay with that.
Hanson?
Yeah, I agree. I mean, but he's got to do that anyway, regardless of what we tell him to do. But I think our emphasis is you better do a pretty good job of it, because we're going to decide whether to open or close this thing. So the budget presentation that he makes to Ms. Petito at this point and to us is critical. He's got to do a good job of that. Got to sell us anyway.
All right, so before we move on to the next part of your presentation, any other questions for us?
Not on my part, no, thank you.
Okay. So we'll move to the next part of the slides, which is, thank you, Ms. Lord, the community service grants.
Okay. So this portion of the presentation is sharing information on the community services grants. I've got with me again Kim Bennett, who is our Human Services Program Manager. The Human Services Division oversees and administers 9 grants to community service agencies. They conduct regular review of data, outcomes, deliverables, invoices, all in ensuring compliance with deliverables. Staff review the grants agreements each fiscal year with review and approval by legal administration and the commission. Prior to 2022, grants, and actually it was well before that, I've recently learned, it was probably about 5 or so more years before that, grants were awarded by a committee. That committee were reportedly disbanded after amounts were reduced and some other factors. But typically, if a service provider is not meeting deliverable standards, Kim will note to them the deficiency and work with them to try and find a plan of action that aims to make up any shortfall. If thereafter they're not meeting the standards and expectations, providers may lose funding. We saw that in the case of a provider in fiscal year 2023. They did not meet the standards, and we pulled their funding from them. That funding was not repurposed. It was just pooled back into the general fund. I would view many of these services and organizations as what might be called mid or upstream investments as a way to offset greater costs to the county down the road. So that could be via increased Medicaid share, indigent healthcare costs, indigent burial, and the like. Here's a snapshot of the grant recipients and their award amounts. You'll see there was a reduction in this fiscal year for a few of the contracted providers. All of these vendors or providers have met their deliverable outcomes in the most recent fiscal year that closed. So in prior discussions, the board had questioned whether or not these grants were just kind of reissued every year, or if there was a need to revisit adopting an RFP process. Again, we don't do an RFP process currently, but we do a thorough review of the grants and their deliverables each year as we renew them. If we did look to readopt the RFP process, we would pretty much mirror what we did in the past and follow our existing procurement processes, establish a funding review panel. They would issue requests for proposals, receive those proposals, rank and score them, and suggest funding. Then that panel would review quarterly reports and guide future funding awards. So if we did look to reinstitute an RFP in a panel process, I would think we would, that should say August 2026, begin around that time to get the panel activated and issuing requests for proposals so that we could issue awards by October 1st. So the question I think that's before the board today is, should we continue as is of renewing year to year the grants to the existing awardees, or would the board like us to consider returning to an RFP process that's a competitive bid process for those and any other organizations that might want to apply as well? There's pluses and minuses to both of those approaches. Again, all of these agencies have been serving and meeting the needs in the community and our grant funding expectations for years. But a closed process also limits new opportunities, new providers from potentially gaining funding as well. So with that.
Can you go back to the list?
Yes.
All right. So comments on the process?
My question would be, what if some new organization comes on and they want to get a grant from you? Is there a process? Do you have a process?
Not currently, not for this funding, no. If we had some one-time funding or another opportunity, we would publish it broadly, but this is kind of a closed year-to-year renewal, and no new applicants have been able to attain it, no.
That doesn't seem right. That doesn't seem right, that nobody else could participate.
So let's just take Early Learning Coalition, because I'm on that committee. In 2024-25, the budget was approved in its totality, and it included a line item for $63,200.
Correct. Yes.
Kim contacted Early Learning Coalition and said, please send us an invoice or whatever process so that we can provide you with your $63,200.
No, it's more of a quarterly reimbursement request. So typically in December, they'll submit an invoice for the services between October and December. And then Kim will check that, did they serve the required number of people? Did they meet all the deliverables that are set out in the contract? And if they do meet those, then we process that for payment and reimbursement. And that's typically quarterly. Some providers do it monthly. I don't know, Kim, did you want to add anything to?
Hi, Kim Bennett, Program Manager for Human Services. Monthly Family Life Center, everyone else is quarterly. And since I took this over 2 years ago, Joe and I have both talked about trying to get this out to make it more of a fair process for other agencies. Prior to that, the 8 years that I was there, these renew. They get approved by the board and they renew every year. They don't go out, they don't.
Do you look at their overall financials? Is that part of the deliverable?
I get a financial audit at the end of each fiscal year, and I get quarterly invoices because in the contracts for each of these agencies, it's broke down what they should be meeting quarterly and then what they should meet at the end of the year. So I get them every quarter. And so far, like I said, I never was even really able to remove anybody from it until 23, 24, because I had somebody continuously not meeting standards. So when Joe came on, he was able to help me, through the process of that and letting them go. But it hasn't gone out for bid that I know of in at least 10 years.
And then down where it says cold weather shelter, there's an asterisk. Can you explain that asterisk?
Cold weather shelter, there's a $24,000 cap, but it also is each municipality chips in towards that. They get $1,000 a night. And for that, they have to rent Church on the Rock. Sue Bickings brings in volunteers to spend the night. They supply all the food. They've had to let the security go because there wasn't enough funding. But we don't know what that number will be because we don't know how many nights. But I also get a nightly. When that opens up, I get a report for every single night that it's open, within a few days of it being open.
Last year it was close, right? We were close to 20-something days last year.
We hit 23 nights,
Yeah.
but we don't pay the whole 1,000.
I understand.
Yeah.
Okay. All right. All right. So there is kind of a system in place right now. The glitch is it's not open to all parties.
General, yes.
And it will renew unless you fail to provide. So if that service changed its scope, changed something about it, which probably none of these have, that would be the only opportunity. And then when you set your budget, this is going to sound weird, but when you set your budget of 486 or 470, how does the organization know what the award will or will not be pending budget?
It's a good question. So we typically try and give them as much heads up of any changes that might be coming. And, as soon as we get kind of the final word on the budget being approved, we'll let the organizations know. In this case, it was mid-September, if I'm remembering correctly. So it is a bit of a tight turnaround on their part to get updates, whether good or bad or indifferent.
This is also the first change.
Yes, I was going to say, yeah. So this is the first, $16,000 change for years. Again, as Kim mentioned, I think it's been steady at that. What is it, 486?
Can I ask Ms. Bennett a question? Are any or all of these organizations doing their own fundraising in addition to this, or is this just a gimme from the county? Because I know one I'm involved with. I've met with others.
There is a percentage of SMA's money that we are mandated to pay. I don't know that number.
'Cause it's the health,
sorry.
right.
And I also know that stands true for Family Life Center.
Correct.
As far as I see myself, every one of these agencies definitely markets themselves.
Not just
They're,
marketing.
they come to our outreaches, of course, hold their own, and they all have fundraisers like Flagler Free Clinic. They do fundraising all year long for their funding.
I just wanted
yeah,
to know
I
that
mean,
these are really active community activists that are working on behalf of the entire community through their talents and their services. And they're working hard.
I think so. I mean, but that's my opinion. Cold weather shelter, that goes without saying.
That's a requirement, yeah.
Yes. Grace Food Pantry, Open Door, very well known, very out in the community. Flagler Volunteer Services, I think we all know what they do. I mean, with us and for the community. Family Life Center, again, they're always doing fundraising.
Yes.
Maybe not SMA Healthcare, I don't really know, but
They have a big event coming. They have a
yeah, I
gala
know they
coming.
do have something coming up.
big
So
gala,
yes, I
yeah.
mean, as far as, I mean, myself personally too, though, I do think out of fairness that this could be opened up because there are a lot of good agencies in our county, and there's a lot of good agencies that might not have the kind of money the other agencies do. So, I mean, I think it going out is a good idea.
Well, thank you. I appreciate your answer. Thank you.
You're welcome.
That's good.
If I can just add, this also helps provide a local match for federal grants that these agencies
Absolutely.
might apply for, which is always a great plus for them.
And as we know, some of them one that I'm aware of, got a tremendous amount of reduction in their grants.
Federal grants.
So federal and state stuff is really getting stickier.
Pinched, yeah.
And pinched quite a bit, and doged, whatever word you want to call it. So they have to do more.
I hear it from all these agencies.
I'm sure you do too,
I work
right?
pretty closely with them, especially at budget time, when we're going into the next budget.
Yeah.
I work close with them, honestly, on a daily basis,
Thank
most
you.
of them. But, I hear their feedback, how much they're getting hit in different places right now, too, and I'm sure.
They're nervous.
And they all do tremendous work, so it's hard to pick and choose who should get what and who shouldn't, because they all do great work, and they all do work that's needed in this county.
And I, for one, and I'm sure the rest of us all appreciate what they're doing for people. So it's really part of our plan as well to see them
They
successful.
They help us,
Yeah.
too, because we do not have a big budget in human services. So I rely on a lot of these agencies to step in and help us.
I just want to make sure they were also doing their, whatever they can do.
I can speak to the Early Learning Coalition, gets to stretch the money that we give them by about 9 times as they, as the other grants that they get rely on local funds like this, and then it comes in at about 9 times what the amount they receive, 9 times what the local matches. So they it's very important for some of these groups that they get local money. So I guess the questions, right? If you open it up, we have to be willing to adjust these or increase the amount. And then the question I have is, when do we, through our budget cycle, we probably have to establish a deadline for when we commit to these amounts, because some fiscal years are in or June, July, as opposed to our fiscal year. So earlier, I think we would need to make some commitments in the spring to this list so that they can budget properly. And we'll have to probably look at establishing that during our budget process. I was an early proponent of the RFP almost going back out, but looking at time and staff time and what would be involved with that, I would rather bring these guys to us. And I spoke to Ms. Petito about using our presentation time on agendas so that they have 10 to 15 minutes to talk to us about what they do and how they're using the money, and backing up publicly the commitment.
Right,
So,
absolutely.
we can start doing that, reaching out and finding months that they're willing to come to us, and maybe no more than 2 a month to keep our meetings.
Got 9 months right there.
Yeah, no, there
months
is,
right
right. So I don't know what your thoughts on that, but I just think if we, again, I think opening up for additional applicants, we would just need to be really careful how that's worded. If we have cap limits on money,
Yeah.
I mean, do you want to set this at a not to exceed 500, and then you've got another 30 to play with, or do you want to keep it at 470 and just adjust the ones we've done?
I don't know that now's the time to raise the funding. I think we just have to be more close to steward to where we're spending it and verifying.
Well, but if we want to open the door a little bit, even just a little crack, then as the
you have a lot
chairman
of
said, the
requests?
500,000, give us
Do you have a lot
a
of
little
requests?
playroom to bring somebody else on.
Yeah. Do you have
That's
a lot
all.
of requests
Is
for
there
outside?
people looking?
I'm sorry. I have gotten requests for the last 2 years from Alpha Women's Center. Well, not just asking, are we going to open up? And to be honest, Boys and Girls Club have asked to be increased. But outside of that, I honestly haven't. Alpha Women's Center is probably the main one that,
Could we just do a miscellaneous category and just see,
That gives a year of vetting.
increase it a few
30,000?
thousand,
It's
and
30,000.
just put in miscellaneous and see if anybody comes forward? The process to open up a grant you're pretty much established on your grant process, right?
Yes, it mirrors the procurement process,
Right,
essentially,
okay.
yes, yeah.
I could go either way. I'd like to see what they do with the money. I mean, I was under the impression that I didn't know if you had measurable, I didn't know all this, so.
Right.
We can
knowing-
always address it next year. We
Right.
can just have
Right,
them come, and then we'll,
Exactly.
for the next budget,
You know,
We've
I'd
got time.
write
Write
a
a
memo on
any
that.
place in the world where you're given money and you don't have to account for it.
Yeah.
So if it's in front of us or in front of you, whatever you feel is the safest way to make sure that the general public's, our taxpayer money is being accounted for properly, that's all we can pretty much ask for. So,
And some of us are on those boards as
Yeah.
well, so
Right.
Yeah.
we're apprised of what they're doing.
I would say they all meet.
We
the
need you on the mic,
deliverables, and
unfortunately. Could you repeat
A
that?
big portion of them exceed them.
Yeah.
okay.
I didn't attach it here because it's a substantial amount of information, but on the agenda drive, there's a backup or reference folder that has the deliverables for each of these organizations there, and how many they've served, how many above and beyond, or whatever it might be. It was many, many pages, so I didn't tack it on here.
Too much
but-
to read, thank you.
but if you're interested, you can go by each organization and see.
I've seen just one organizations, and that's enough to make
It's a
me
lot,
dizzy.
yes. There's a lot going on.
Yes, it
Good-
is.
Good
Thank
stuff,
you.
yeah.
all right, anything else?
Thank you for your patience and your help. Appreciate it.
Right.
Thank you, Kim.
All right.
Thank you, Mr. Hagedis.
Thank you. We'll be back in January.
All right, very good. Thank you. Appreciate it. I'll open it up for a public comment if anybody had public comment on adult daycare and community service grants. Yes, sir.
Raymond Royer, Painters Hill section. To the chairman, thank you for giving them another second chance here and having them come back. It's dear to my heart. These programs are all in a crisis. I sit on the public side for affordable housing, and all these programs are hurting. And you also got to look at, yes, there's 9 people, but there's actually 18 because the other 9 are getting their hairs done, taking some time for themselves. And that adds on to them. If they don't get that time, they're going to be the next one needing that help. So it's actually an 18 number, if you look at it that way. Yeah, these programs are all in crisis, and the gentleman that was up here speaking on their behalf, he sits on a lot of those programs, and he's always scratching for funding and grants. And as a veteran, I would try to help him try to find some funding, because if some of those patients are actually veterans or wives of veterans that are receiving veteran benefits, I'll research and I'll go over here to the Veterans Administration and see if I can help them get more money for the veterans, because I'm sure there's other counties that are getting money, but it's probably, it took me a while to get my benefits, my percentage from the military, so it takes time. I kept getting denials. So there's, but when you talk to these guys, they know the language to use when you fill out the report. So I'll help this gentleman out. But that's all I have to say, because this could be a downfall, and it's nice that it's the only program we have, and it's nice that we have all those certifications, because if we do let it drop, and then we try to restart it again, it's going to cost a lot more to do any startup. Just like a business is, it's very expensive to start businesses. So keep that in mind, and I know these guys will work it out. Thank you.
All right. Thank you, sir. Anybody else for public comment? Seeing nobody approach, we'll close public comment and go to our next item. Mr. Mangle. No.
It's actually going to be our land management team. So the next presentation that you have is regarding a request from a local church that had contacted the county for some assistance with some parking needs. The church is currently landlocked. It's located in Espanola. It does have limited space to accommodate a growing congregation. Because our Espanola Park property adjoins the church property, they've asked us to explore potential options for additional parking. Eric has been working hard with them to identify some possible solutions, and so he's here today to present the details and some possible considerations for the board.
Welcome, Eric.
Thank you. Eric Revuelta, Public Lands Manager for Flagler County. I think it's a fairly straightforward request. The church has been in contact with us before in 2023. It's unclear exactly where that process left off, but they kind of came back and made the request again to have this area from the Espanola Community Center be sold to them so they could expand parking. There is an existing driveway that connects the church to County Road 205. And so it's in an area of the park that is not really integral to the use of the park. There are no amenities, and really, if you see the configuration of that northern portion, there's not a whole lot of future plans that would be affected by the transfer of the property to the church. Potentially, the one thing that Adam did bring up is we may want to keep a 15-foot utility easement on the western side of the lot along 205, just in case there's anything like that we need it for in the future. But that's the request, and we are looking for your input and direction as far as whether or not to go ahead and start that process.
Okay.
And and I was going to say the process would be fairly straightforward, and the church would be responsible for any of the costs associated with, the transfer fees, recording fees, survey, and all that, as well as I think the future use would be a parking lot. So they would also would need to come back and get approval for changing the zoning. This is zoned for MH1, so they would have to change the zoning to be able to build a parking lot. They would also need to get county permits for the parking area, as well for any tree removals. There's a few trees in the area. And they would also be responsible for going to St. John's River Water Management District, DEP, and any other agencies that they need, that they would need permits from, so.
Okay.
So they'll be responsible for maintaining that area as well.
Correct, it would become theirs.
But I'm saying they'd be responsible, except for that 15 feet, which
Yes,
would be the right-of-way for the county.
correct.
Okay, thank you.
Can they hardtop well, I'm sure this is never, not going to be hardtop, but can they hardtop the 15-foot utility easement?
We have not had that discussion, but probably our preference would be not to, just to be able to retain, not to have to tear up half the parking lot in order to put a utility in the future.
And what happens to that little red triangle to the north?
Yeah, that was my question.
Yeah, where's that going? Yeah.
What happens to that poor little
Whose is
guy
that?
that just sits out? What's that total acreage?
That is about 0.1 acres that is
0.1?
left over. Yeah, 0.1 acres. So it still would remain with us unless we want to make it part of the transfer to them. If we think there is no maintenance in that area, it's kind of just overgrown vegetation, so it's not like something we've been mowing or maintaining. But we could approach the church if it makes sense for them to go ahead and have that as well.
Well,
But
the only problem with that is that it's residential. You can see there's houses.
gonna say,
So
what's
you
north
could
of it?
potentially tear that down and make their backyard a parking lot. I don't think that would be fair.
Correct.
Are they, will there be any compensation? I mean, are they wanting to buy this 0.3 acres?
They are wanting to buy the 0.3 acres. We have not discussed a price, and that is something that, under the statute, we're allowed to charge essentially whatever we feel would be fair. So if we wanted to do a, $1, $500, $1,000, or if we wanted to go ahead and do an appraisal and see what it appraises at and request that amount, that we could go in that direction as well. So the board has flexibility as far as setting a price for the area.
And the existing driveway, how did they get that if it's our property? How did they get the driveway put in?
That driveway apparently has been there for a long time, but I'm not sure how exactly. So it may have been one of those uses that was in place prior to the property being transferred or acquired by the county.
But the zoning will have to change, even though it's a driveway now.
So I'm not sure that the driveway, that might be more of a zoning question, but if it's grandfathered or if it's been in a continued use for a long time, I think it's probably consistent with what is there. I think it's when you come in for development that would trigger the need for changing the zoning. And Adam, if you want to, okay, Adam's giving me the, I'm not a zoning expert, so.
Okay. It's just, I don't know how fast they're growing, but I don't know how many cars you can fit on 0.3 acres, especially if you're going to take 15 feet, use it as an easement plus a driveway, or maybe they're one and the same, I don't know, utility easement and the
The utility easement would be a strip kind of along that curved property boundary, so parallel to it.
Oh, so we're doing that in the front? That'll be in the front?
Yeah, that would be in the
Okay.
front.
That'll be off
That would be along,
302,
that would be along the
204.
road.
Along the road?
Yeah.
I'm sorry. Okay,
Yeah.
I get it.
The driveway would become part of their parking area.
And then once they submit their plans for the driveway, it'll include runoff, flooding, water, stormwater management, and all that?
Absolutely. I'm not sure what the development requirements are from the county. From Water Management District perspective, they get up to 4,000 square feet of parking that does not require any stormwater. So that would be something that gets worked out through the state permitting. at that point. If it's exempt, it may not be required, but
Okay,
I'm not sure with the changing in zoning if we have something else.
Okay.
So, yep, I'm getting, we would look at.
In the event of like flooding in that area, would it be a problem for that 1.1 acre right next door? Would that, does it flow up, down? Do we know about that? Adam squinching.
We have not looked at that specifically. I did not look at that specifically.
We've talked about that on other properties, causing the neighbors' properties to have flooding. That may be an issue.
What I anticipate is that there is probably, and I believe I remember this, that it's probably a conveyance ditch along the side of County Road 205. That'll probably be ultimately what receives any runoff from the property. And the 4,000 square feet, the reason the 4,000 square feet is kind of like that threshold number is that typically when you have that small of an area, it's not going to be a major contributor to flooding unless you're doing it in floodplain designated area you don't have here. And from what I remember, I did not see wetlands either. So I think they're from that respect, they're okay.
Okay. That's been a big run-on with all the rain we've had.
Oh, yes.
And this year was a very, very heavy rain, but we don't know what next year is going to bring. That's the concern I have, as just that.
Yeah.
Because I see it looks like it's residential right next door, correct?
Correct, yes.
Yeah,
Those
so that
houses.
could be a harm to them if
Yes.
it was to do that.
It could
So I was wondering. Okay,
So
thank you.
they would be required to maintain historical water conveyance in the area, so it's not like you could build up
Okay.
and then
Okay.
flood somebody else. That
That's
would
my
be an issue.
concern.
That would
Okay,
be an issue.
Thank you.
Yeah.
That's it.
Okay. As I looked at this, I think we all looked at the little triangle and figured out what do we do with that. Could we do to the and I agree with the comments that I don't think it goes to the church because of the incompatible use of parking behind those residential lots. But could we offer to the other adjacent property owners the opportunity to, if they wanted to,
Yes.
so we could get rid of that triangle and just offer it to
Yes.
them as well while we're doing this process?
No,
No?
here's two two related concerns. First concern I have, I want to ensure the statute, while it does allow us to sell this property to a nonprofit without putting it out to bid, the nonprofit has to be specifically organized for community purposes. Churches are not normally organized for community purposes. They're normally organized for religious purposes. So the intention in their application for this piece of property is going to have to show that the intent for the property is for it to be used for, as what the statute describes as let me pull it up again, it's a community for public or community interest and welfare. That's the caveat for the county to be able to sell the property without putting it up for bid. The triangle, in order for it to be sold, we can't just sell it.
It has to be sold.
It would have to be sold we would have to put it up for bid.
Gotcha.
So that can't be sold just to the residents. But as far as this church is concerned, they would have to show in their application, one, that they are specifically organized for the purposes of for the purpose of promoting community interest and welfare, and that the use of the property is for the promotion of community interest and welfare, kind of almost separate from their religious purposes. So there is a distinction. Usually it's almost a distinction between a 501c3 and a 501c4 in order for that to be subject to not have to be subject to the bidding requirements or putting a property up for bid by the county for sale.
So is this a little bit premature for us, or did you want us to let you continue to work with them
We could
to
look
find
at
that
it, see what's
purpose?
their intention. I mean, if it's simply going to be a parking lot expansion for their church, I mean, on the surface, that would then be an expansion of their religious use. And I don't want to put this up, have it be sold, and then subject the county to a potential challenge of selling public property without it being put to bid. to the public.
Could you state the statute section that you're
That's
reading from?
125.38.
3.8? Thank you. So we should have taken this a couple more sections, because we
The
stopped
next
at 3.5.
Well, 3.8 is also listed. I just read, it's just, well, it lists, the 3.8 section is the ability to sell property without putting it up to bid. And that would be just simply selling it to the federal government or to the state of Florida or to another government. And then it's to nonprofits. But the nonprofit has the caveat that it's not just any nonprofit. It has to be a nonprofit specifically organized for the purposes of promoting community interest and welfare. So that's that really thin caveat for the exception for those organizations that would not be subject to having to purchase or to have to bid for the sale of public property, for county property, which is distinguished from municipal property that can be sold to anybody at any price.
To me, if you continue to work with them to see if it meets the statute.
Right, or if they come up with it, if they actually come up with it, because a
Right.
church can theoretically say, well, we do have a community interest. There's a portion of our fellowship that is
Right.
for, and that application can justify it. Then it could move forward, and we can show, no, this is the purposes for this acquisition is to further their community interest. Then it's something that can then be justified and defensible.
How do they get in now? Where do they,
The road on it.
you say there's a road, but do they not park? Is there a parking? It's so small.
They have very small parking. I think that's part of the reason why they
It's almost
want
like a
to-
driveway parking, right?
So they have two access points. There's there's the driveway that comes in County Road 205 on the west side. And I haven't seen whether or not they pull vehicles on the side or if they do any of that, which they may. But they also have access from the east side, from John Knox Road on the east side. And they have a small parking area, maybe 15 to 20 vehicles.
And
It's hard to see
Adam,
from
in the
this.
back, you can shake your heads. I know in the hammock, we allow the alternative materials. So that we could, instead of paving, there'd be options for them using alternative materials. Okay, that's a yes.
And I was also gonna suggest that we also have the option of just pursuing a lease instead of a sale.
That's what I was going to mention that. So
that's
I
also-
didn't know the benefits of that. I think should be brought forward too. Which one would be better? And they would both have some reverter too if the property became.
All right, we could look into that.
Yeah.
Yeah.
Okay. All right.
Okay.
I don't have any other questions. Anything else?
No, I appreciate when I read it at 38, I said, yeah, sure, they can do that. So I appreciate the explanation. Because just reading it as a layman, I went, oh, yeah, they can do that. That's fine. No, I guess they can't. Thank you.
Anybody else? All right. Thank you, sir.
Thank you.
Appreciate it. All right, we'll open up for public comment if anybody has comments on this agenda item. All right, seeing none, we'll go ahead and close public comment. Any other items anybody needs to discuss before we re-adjourn at 5 o'clock tonight?
Other than it's freezing in here.
Yeah, snow. There's snow on my
It's
roof.
comfortable.
Comfortable.
It's comfortable.
All right, we'll go to open public comment if there's any public comments on anything.
Raymond Royer, Painter's-Hill. I think in the beginning of the year when I started attending meetings here, you just mentioned about you were possibly going to open up longer periods of time for public comment, and you just haven't discussed it any further. I think it was like January, February. You kind of.
Yeah, I don't remember that at all.
Yeah. So
I don't remember that.
I was just wondering if you were going to consider maybe, because sometimes, you give the 30 minutes and there's 20 people here trying to talk, and some of them have very good public comments, so you maybe widen the time from a half hour to an hour when there's more people. Like I would see, like sometimes you do like a normal raise your hand, how many people can do public comment? It's 30 minutes. Well, 6 get 5 minutes each, you know?
Yeah, I don't think I've ever seen usually we have long public comment
Yeah.
at agenda items, but not on these open public comment sections at the beginning and the end. I don't think I can recall one where we had lengthy times where we had to cut it off. It's been few and far between.
Yeah, just let you.
Yeah, the limited, the ones on each individual item are not limited.
Yeah,
Yeah,
Go
yeah,
on for an hour.
right.
right.
Hours.
Right.
Hours.
Midnight
But thank
hours.
you.
Hey, thank you.
Bye-bye. All right, seeing no other approaches for public comment, we'll close public comment, and I'll take a motion to adjourn.
Move we adjourn.
All right, we're adjourned. Thank you. See you back here at 5 o'clock.
Sure. I got a sick husband.